South Africa has not yet taken a decision on how to proceed with the Johnson & Johnson COVID-19 vaccine. That's the word from the Ministerial Advisory Committee's Professor Barry Schoub. This follows the recommendation earlier that the U.S. should pause the use of the vaccine because of rare cases of blood clots. South Africa has vaccinated almost 290,000 healthcare workers with the Johnson & Johnson vaccine in an ongoing research study. Professor Schoub now joins us. Thank you so much. Welcome to our program.
Good evening. Thank you for having me.
Well, we actually have the information about the COVID-19 vaccines which were developed. So the process was seen to be a hurried one under pressure to come up with it before the pandemic would even worsen its ravaging tendencies of the world population. So now, do these findings come as a surprise?
Yes, they're not really a surprise. This is a vaccine which is rolled out to millions and millions of people. Unprecedentedly, there's never been a vaccine which has been rolled out to such a large extent to an adult population. And because it's a vaccine given to healthy people, it has to be monitored very, very, very closely and very, very thoroughly. And all events that take place after the vaccine, what we call adverse events, have to be investigated very thoroughly. So this is, as well as the FDA, that's the regulatory authority of the United States, has called it, this is an abundance of caution. They're really kind of putting the pause button just to make absolutely sure that this association is not just what we call a temporal association, in other words, in time, or is it in fact a causal association that the vaccine has caused it? And if there is a causal association, how common is it? Because you must remember, what these vaccines are used for is to prevent COVID disease. And there's certainly the complications are much, much more serious and much, much more common. So even if there were to be a cause association, we'd need to balance the one against the other. Because the COVID disease is a much, much more serious problem. But the thing is that at this stage, it is really part of the very rigorous monitoring, picking up these what we call adverse events and seeing are these adverse in fact side effects of the vaccine. So in this country, in South Africa, as you say, we just vaccinated just under 300,000 people as part of the implementation study. It's not really a trial, it's a study. And a lot of data has been collected. So far, there hasn't really been reported incidents of clotting disease. But of course, we do have to be very cautious. And we have to kind of investigate all reported adverse events to see is there a cause or not.
On layman terms, if one were to ask about the process of developing a vaccine and looking for after effects in the pilot studies, would one then be correct to infer that perhaps one should look into blood thinners as one of the solutions of putting together a vaccine that contains that kind of an agent? That is just somebody opinionating as the man on the street.
No, not at all. No, not at all. In fact, the particular clotting disease, it's called a thrombocytopenic thrombosis. It's a bit of a mouthful, thrombocytopenic thrombosis. In fact, for example, heparin, which is a blood thinner, actually aggravates it. So no, there's no, and also you must remember, we're talking about very, very rare. In the United States, they put the pause button, they'd already rolled out 7 million doses, and there have been 6 cases out of 7 million. I think blood thinners themselves have a much higher complication rate. In fact, in Europe, where they actually looked at the European data, they actually found that the number of people that got thrombotic disease who weren't vaccinated at that same period of time was higher than the people that were vaccinated. So you really got to be actually assured that, in fact, is the vaccine causing these clotting disease, or does it just happen that people are getting clotting disease at the same time that they're getting vaccine, unrelated to the vaccine? This is what we need to look into, and it's been looked into very, very thoroughly and very rigorously.
That may sound like not taking caution and sweeping this alarming situation under the carpet, Prof, because one would then wonder if it's causing blood clots in one region of the world and we don't have reports of the J&J vaccine not causing clots in South Africa, then we have just vaccinated our frontline staff. Should we be concerned?
Look, I think there is a concern. I think all these things need to be investigated. We can't dismiss it by any means. And certainly I'm very, very far from suggesting that they have to be investigated. They have to be investigated thoroughly. We're giving vaccines to healthy people. The last thing we want is that vaccines given to healthy people are causing illness. So we need to investigate the things very, very thoroughly. We need to get a very, very clear idea. Is it caused by the vaccine, or is it just that it's happening at the same time? And how common is it? Because at the moment, these are very rare complications. We're talking about 6 out of 7 million, or in the European data, it's about 30 out of 80 million. So these are very rare side effects.
Prof, let me challenge you on that front, because if you are getting information like this, but you find unrelatedness, what are you going to do when you find out that at a later stage it will have the same effect? Would that then not cause a problem that even the neighbors, Botswana, halted their vaccination program, South Africa did not act? Is that not a cause for concern regarding negligence?
Not at all. You must remember we are preventing a disease which certainly does have complications, a serious disease. A large number of people have died, 50,000 more, and plus people have died in this country from COVID. Many, many more have had a very long-lasting, serious side effect. That's what we're preventing. Now, the vaccine, all these side effects have occurred very soon. In fact, 2 weeks after the second dose of the vaccine, in a very short period of time. Long-term side effects on vaccines, there are really no vaccines which have given long-term. All the side effects of vaccines have been in a very short period of time after receiving the vaccines. So I think the chances of long-term are very, very, very remote.
Prof, somebody may be sitting at home saying, the United States has reports about blood clots. Botswana holds its vaccination campaign. South Africa hears about it and does not act. So what must happen to the current vaccination process, and what will happen to the millions of the vaccines that have been procured? Should South Africa continue or just heed this caution and do nothing about it?
Now, look, I can't say we're going to do nothing about it. We're having a very urgent meeting tomorrow to actually discuss it with a group with our advisory committee, wider than the advisory committee, with expertise to look very, very closely. As I said before, and I must emphasize it, we are very, very not at all looking at overlooking it. This has to be investigated very intensively. So we are doing that, but before a decision is made, we need to gather information. We need to look at the data. We need to look at the information. We need to make an expert, scientifically based recommendation what to do for going forward.
Professor, I'm speaking to somebody, one frontline worker, may have had the Johnson & Johnson jab. What goes through their minds when they hear about this? Should they be worried? And also, members of the public who have not been vaccinated as yet, listening to our conversation now, should they agree to be vaccinated in the future when there's so much uncertainty, when government is going to meet and talk about this? A jab is a jab, and once jabbed, you can't reverse it.
No, look, I think there is obviously a certain degree of anxiety, but I think we need to reassure the public on 2 scores. One of them, that the vaccine is preventing a serious disease. That's for sure. We've got the data on the disease itself. So if you've had the vaccine already, you can be assured that there are a very, very good chance that it's going to prevent you getting severe disease. Very, very high level of prevention against severe disease. And probably will also prevent you getting mild disease. So that's the advantage of having the vaccine. In terms of the side effects, or if there is a side effect, I'd rather call it an adverse event, because we haven't really established, is it a side effect of the vaccine or not? You're getting an adverse event, or in fact, if it does prove to be a side effect, it's going to be extremely rare. Life is not free of risk. Living has got some degree of risk. This has got a very, very low degree of risk. Going in a motor car or doing any other activities certainly carries a much higher risk. I know it doesn't reassure against getting the vaccine, but I think you need to the public would need to realize that what is being investigated is, in fact, is it due to the vaccine? If it is due to the vaccine, how common it is. At the moment, it seems to be extremely rare. And at the same time, it's preventing a disease where the complications are not so rare.
From the large number of those who have been vaccinated so far from the frontline working community, through your monitoring and evaluation and feedback processes, have you gotten any hint as to how our people are doing?
Yeah, this is being very closely monitored. The Sisonke trial, which is just what it is, or Sisonke study, I should say. It's an implementation study, not a trial. The data is being very, very closely monitored. Data is being collected every day, being analyzed, thoroughly analyzed. And to date, the only complications of the vaccine have been very, very trivial, things which have been tolerated very easily. So very, very minor side effects in some people. Not all people. Some people have got no side effects whatsoever. Some people have experienced very mild side effects. Nobody so far has experienced any side effect of any seriousness so far.
Right. So, Prof, we expect to speak to you tomorrow after your meeting so that you can keep us apace with the decisions that may be taken out of the meeting that you're going to have. It surely would be interesting to hear what you were talking about. And there's so much curiosity and anxiety at the moment concerning other countries halting the use of J&J, and we have to now be on alert to hear what you'll have to say next tomorrow. So is this an appointment for us to speak after your meeting?
Yeah, let me clarify. We're an advisory body. We don't make the decisions. The decisions made by the department together, and also the regulatory authority, SAPRA. Our Ministerial Advisory Committee is a group of experts, scientific and medical experts, looking and making a recommendation. So, it'll go from there forward. All
right. We expect to hear about that recommendation as well. One piece of information counts.
Yeah, sure. No, absolutely. No, look, I can understand that the public need to be reassured, but I hope what I've said up to now has provided some degree of reassurance. What happens that this is unprecedented, that we've had a vaccine which has been so carefully monitored, so rigorously investigated, much more than vaccines up to now, and with the depth of science which is unprecedented. So I think that itself, should provide reassurance. These signals which have been picked up now, these adverse events which are picked up now, are really a product of such a rigorous monitoring program. And I must re-emphasize they've been extremely rare, and we need to still establish, are they just at the same time or in fact related to the vaccine?
Right, Professor Barry Schoub is with the advisory committee speaking to us about the meeting that will be held concerning the use of Johnson & Johnson vaccine. And we thank you so much for making time to speak to us right here on SA Today.